We in the United States and other developing nations have great advantages. We have the best healthcare system on the planet. We can go to our doctor's office for immediate diagnosis, resolution, and at any time get a copy of all of our medical records to take to another doctor. People in developing nations are not as fortunate. I've got friends of mine that are doctors and nurses at Doctors Without Borders and the American Red Cross, and they said one of their biggest problems is the lack of record keeping. When they go out to a field hospital, there's no paper and pencil, so they can't keep records of what is happening with the patient. When the doctor or nurse leaves, all the medical records of the patient leave with them. So unfortunately, this leads to a lack of continuity of care with these patients. How can we solve this problem? We're going to offer EMRgent Technologies. EMRgent Technologies is a cloud-based solution whereby a patient's medical records are stored in the cloud, and these are globally accessible 24 hours a day. One of the largest problems with the indigenous population of these developing nations is the illiteracy rate. We're going to solve this with the use of biometrics. Since biometrics are unique to every person on the planet, we can use the biometric patterns of patients to identify the patients with their record keeping. We're just going to start off with fingerprints, since fingerprints are the easiest, and we are going to use fingerprint dongles on each of our tablets that we'll be providing to all these relief agencies to scan all the patients, and that will be an access to their patient records.
We currently have a working prototype that serves as a minimum viable product for an initial deployment to Africa. With the system in place, the next obstacle was finding a cost-effective but durable device to provide to these nonprofit organizations in order for them to service these developing countries. We found a solution. A potential partner in India that manufactures a $50 tablet with an accompanying $10 USB biometric thumb scanner device. We found that our technology actually has a much broader application than just servicing the citizens of developing countries. The WHO estimates that there are roughly 4 billion people worldwide who lack sufficient access to modernized healthcare. The US alone intends to invest $90 billion in upgrading private doctors' offices and other medical institutions to electronic medical records databases. This is why we plan to deploy to developed countries in the future. We are currently in the process of filing for nonprofit status. This status would make us eligible for the various funds available through endowments and foundations. These include the Bill and Melinda Gates Foundation, the WHO, and the UN Foundation.
We have a great idea and we have a great product, but it is the team that brings it all together. Let's meet our team.
Using Powtoon.